And now I want to show you what a lung in Delhi looks like 10 years ago in 2015. Just take a look at these two pictures, viewer, and you will know for yourself. Over here is a healthy lung from somewhere in Himachal Pradesh. This was a picture put up 10 years ago when the pollution wasn't anywhere close to what it is right now. And this is what a Delhi lung looks like. This picture was put out and released into the public by Dr. Naresh Trehan, one of India's most well-known and renowned and respected healthcare professionals. This is what those two lungs look like. And joining me live now to talk about this absolutely genocidal situation is none other than Dr. Randeep Guleria, former director of the All India Institute of Medical Sciences, chairman, internal medicine, respiratory and sleep medicine at the Medanta Hospital, and one of India's perhaps most respected and renowned and regarded pulmonologists. Dr. Guleria, thank you for your time. Good to have you here on India Matters, on a story that should be giving us sleepless nights, but somehow it is not ringing alarm bells in the highest levels of power or even in Parliament. But I want to start by asking you about what you are seeing, sir, as you deal with patients, as you treat people who come to you. How bad is it?
One is the short-term effects and the other is the long-term effects. And if, like you rightly said, people who are living in central India, that is the Indo-Gangetic belt, including Delhi, have a lot of respiratory, cardiac and other problems linked to air pollution. As a matter of fact, if you look at the data from the Health Effect Institute, it calculated that globally in 2024, 8 million people died because of air pollution. Most of these deaths occurred in the developing or the emerging markets, and the number of deaths that they calculated were more than the number of people who died because of COVID-19. So we have more people dying because of air pollution. We do nothing about it. We made a huge hue and cry about COVID-19 deaths, and that really shows how sort of irresponsible we are. I think this is an ongoing pandemic where Delhiites and people in this part of the world are suffering a lot. It's a silent killer, and that's why people don't seem to understand what the problem is. We see all of this during the winter months, but if you were to look at the AQI of Delhi throughout the year, we have very few good days. Most of the days in Delhi have very poor AQI, and like you rightly said, it's like being chronic smokers. We know that smoking is linked to cancer, we know smoking is linked to heart disease, we know smoking is linked to lung problems, chronic lung disease, but it's also important to understand that air pollution has a lot of fine particulate matter, PM 2.5, ultra-fine particulate matter, and certain toxic substances attached to these particulate matter, known as toxic hitchhikers.
Yes.
They actually go through the PM 2.5, they attach to PM 2.5, enter our circulation, and then start causing problems not only in the lung or the heart, but dementia, Alzheimer's disease, and metabolic syndrome, joint problems, all get aggravated. So it's not only a lung or a cardiac problem or a cancer problem, it's a problem which affects the entire body. And unless we take measures on an emergency footing, we are actually causing harm not only to ourselves, but to the future generation.
This statistic, Dr. Guleria, of more than half of lung cancer cases now being of non-smokers, talk to us a little bit about that. I find that incredibly alarming. If 90% at one point used to be smokers, now up to 70% are non-smokers, sir?
Correct, that is true, because initially 20-30 years ago, smoking was the only risk factor for lung cancer. As a matter of fact, if you go back 50 years ago, lung cancer was considered a rare disease. Then smoking became common and it was actually linked to smoking. And it was felt that anyone who developed lung cancer had to be a smoker. But now non-smoking lung cancer, both because of indoor and outdoor air pollution, is becoming the top cause of lung cancer. And there is a lot of data from the developing world which has shown that air pollution contributes a lot to not only lung cancer, but even other cancers which may be related to the toxic effect of air pollution.
So I want to ask, I know you are not a politician, Dr. Guleria, but I must ask you, why isn't this a more pressing issue? If this is a slow pandemic, it is more serious than COVID, like you said, and coming from someone like you, that is a very alarming thing to hear. Why isn't this ringing alarm bells in the highest levels of government and parliament, sir? How do you read that?
So I think it's important that people decide and really understand the implication of what air pollution is causing. I think that understanding is not being there because, like I said, it's a silent killer. So if you have someone who dies because of COVID, or if you have someone who dies because of dengue, you have a test to show that this person died because of COVID or dengue. If you have someone who dies because of air pollution worsening his underlying condition, you're not able to show it. And unless you start writing on death certificates that this patient died because of air pollution causing this problem, it's not something that people will wake up to. Secondly, I think it's important for us to understand that air pollution is all over. It's, for example, you could say you could have safe drinking water, but air pollution will affect the politicians, the common man, and everyone in a similar manner.
What is the, from a government level, sir, today the Delhi government has set up a panel to monitor the pollution levels. We do know there are certain piecemeal things taking place, but, the cynic's view in this whole thing is that since there is no political benefit in battling pollution, it doesn't win you votes as such. Nobody really sits across the table, across party lines, and discusses a unified strategy, to battle pollution. Is that something that worries you, sir?
Yes, I think that is true. Unless an election is fought or won or lost on issues of air pollution, people are not going to wake up. And I think if we wake up, there are solutions which are available. And there have been solutions in Delhi itself. I'll give you an example.
Yeah.
In 1998 and 99, air pollution in Delhi was very bad. We had very bad AQI even then. And then because of a lot of pressure, Supreme Court coming in, CNG came into place, and all public transport and public taxis and all had to have CNG. Once CNG came in, and there was a lot of hue and cry that CNG will not work. But once CNG came in, it actually led to improvement in the air quality. But we lost that benefit by having more diesel vehicles, more construction. And now we've come to a situation where air quality is even worse than what it was in the late 90s and early 2000s. So there are solutions. China has found a solution. So I think we can find a solution. But we do need to have that will and that push to really work together to find a solution.
And one expects, Dr. Guleria, and you know this well, that this government, has been known to take the bull by the horns on difficult issues that may not be popular sometimes and actually try and solve them.
Correct.
But for some reason, so far, pollution doesn't seem to be one of them. And that is something that is upsetting and troubling people, across the board. Because, like scores of people, including you, have pointed out, pollution spares none. It is the great equalizer. President Putin is arriving tomorrow in Delhi. He is going to be breathing the same air as us, sir.
So that's true. I think it's important for us to really make politicians understand the importance of air pollution and work on a strategy. We need to have a long-term strategy. It's not going to find a solution overnight. But if we have a target that every year we will bring down the poor air quality by that percentage, we should be able to do it. We can have a 5-year plan, but really show that it's implemented. So it's not only having a policy on paper, but being able to implement it and show proof of concept that this works, and be able to look at what are the emission sources, what are the causes. We have to find our own solutions. And I think if we do that, we will in the next few years be able to not only benefit our own self, but the future generation also.
Right now, the future generations are cursing us, and I hope they will find a reason to thank us for biting the bullet and taking this issue head on and at least starting to solve it, because this is an issue that cannot be ignored any longer. Dr. Guleria, thank you very much for your time and for giving it to us so candidly and honestly. Coming from someone like you, it makes all the difference in the world, because otherwise there is so much misinformation. But coming from you, I hope that the powers that be and the people will listen. Thank you, sir.
Thank you very much.
We live in a country where sometimes issues cease to matter unless there is some kind of an immediate electoral benefit or payoff. That is the cynical truth of this democracy we live in. But I leave you with these images: a healthy lung and a lung that is in Delhi. My lung probably looks very much like this one. Stay healthy, stay safe. We will continue to highlight the big issues right here on NDTV. Buck Stops Here with Padmaja is next.